Hello, my name is Ying. I am a doctor. Welcome to your lecture series. Today we are talking about familiar diseases. It is now spring, a time when a lot of people get a disease called allergic rhinitis. Today, we will be talking about allergic rhinitis, which is also commonly referred to as hay fever. Today's lesson plan is here. We will talk a little bit about what hay fever is, what the causes of hay fever are, as well as what the possible treatments for hay fever are. So hay fever is the common layman term for the medical condition known as allergic rhinitis. Allergic rhinitis is inflammation of the nasal membranes, which means the inner linings of your nose caused by an allergen. So here, if an allergen enters your nose, the inner linings of your nasal membranes can become inflamed, and you may get a reaction to this allergen. Common allergens include flower or tree pollen, dust, and animal hairs. The origins of the term hay fever is thought to originate in the 19th century when people believed that the smell of hay in the summer season affected the body. It is only 30 years after that that people realized that actually the true cause of hay fever or allergic rhinitis is most likely an allergen known as pollen. However, it still remains true that the symptoms of allergic rhinitis are most common in the spring and summer months. Pollen is one of the top causes of allergic rhinitis. Depending on the type of pollen that you might be allergic to, your symptoms can vary with people around you who may also suffer from hay fever. For example, tree pollen is common early in spring, grass pollen is common later in spring, and in early summer. For example, in the Kanto region, pollen types vary greatly depending on the season and the month. The Japanese alder, or hannoki, peaks from mid-March to mid-April. The Japanese cedar is at its highest from the beginning of February all the way until the end of April and remains quite high until June. Pollen from the cypress family trees is commonly found and remains high between March and April, and grass pollen is found early on in summer and also near the end of summer into autumn season in September. For example, flowering plant pollen is commonly found in September. So if you live in Japan and if you are allergic to all these types of pollen, it is possible to have hay fever for almost the entire year. Typically, the symptoms of allergic rhinitis are very similar to catching a cold. Sneezing, a blocked or a runny nose, itchiness, cough, and watery eyes. Sometimes in severe cases, you may also feel fatigue, which is tiredness, and also sleepiness may be present. Although the symptoms of allergic rhinitis are usually mild, occasionally they can become quite severe, debilitating, and they can actually affect a person's ability to focus at work or school and carry out their daily activities. Now we will talk a little bit about the biochemistry behind allergic rhinitis. It is quite complicated. As you can see from the diagram here, it first involves a cell in your body called a mast cell, which I have labeled here with an M, being exposed to an allergen for the very first time. Once your body has been exposed to this allergen for the first time, it becomes primed, which means that it will recognize this allergen the next time your body is exposed to it. When your body is exposed to it for the next time, the mast cell will release some natural chemicals. One of these chemicals is known as histamine. Now, histamine, as well as some of these other chemicals, are responsible for the symptoms of allergic rhinitis or hay fever. Allergic rhinitis is a common illness, and it affects about 10% to 30% of both children and adults in the US and other developed countries. It is a very common reason for people to go to see their doctor with, and it is also a very common reason for people to buy medicines for. Thus, allergic rhinitis has a very significant burden on a country's economy. So who is at risk of getting allergic rhinitis? What are the causes of allergic rhinitis? It is not yet completely understood why some people might be more sensitive to tree pollen or grass pollen or any other kind of allergens compared to some other people. However, research has shown that there is a strong link between family history and allergic rhinitis. This means that if a parent or a sibling, perhaps a brother or a sister, has allergic rhinitis or a history of atopy, such as having eczema as a child, the patient will also be more likely to develop allergic rhinitis. Also, if you are persistently exposed to allergens, this may also increase your risk of developing allergic rhinitis, or perhaps worsen the condition of people who already have very bad hay fever. Research has also shown that globally, allergic rhinitis is actually on the rise. This means that the number of people who suffer from hay fever every year is increasing. This is probably because of environmental factors rather than genetic factors. For example, in the past several hundred years, we have seen an increase in hygiene and sanitation standards, as well as lifestyle and diet. We live in cleaner places, and our houses and the areas we work in are much cleaner. This may be one reason why more people are developing allergic rhinitis. Currently, studies have shown that about 40% of children have allergic rhinitis. In Japan, it is shown that also about 40% of people have allergic rhinitis every year. In countries where the prevalence, which means the number of patients who have hay fever, is high, especially in peak pollen season, such as spring and early summer, the government may try to help people suffering from hay fever symptoms. For example, when they report the weather, they may also report on pollen levels as part of the weather forecast. This is to help people who have allergic rhinitis avoid pollen exposure as much as possible. So, as previously explained, one of the main natural chemicals the body produces is histamine, released by the mast cell. So, for hay fever treatments, one of the most common forms of medicine which you can buy is antihistamine medication. Antihistamine medication will treat the effects that histamine causes. This is easily available to buy over the counter at pharmacies without a prescription. However, it is important to note that there are two types of antihistamine medications: sedating and non-sedating. Non-sedating antihistamines means that these medicines will not make you drowsy. You can take them and you can still work. However, depending on the type of work you do, it can still be quite dangerous to take antihistamines, especially during the day. They can also cause sedation or drowsiness if you take them with alcohol. Other medications which can also be used are antihistamine eye drops for itchy and watery eyes, or saline nasal sprays and decongestant medication for nasal congestion. These are sprays which you can spray directly into your nose and help to relieve the symptoms inside here. Very rarely, oral steroid tablets may be prescribed with patients for severe allergic rhinitis symptoms. It is also advisable to avoid known allergens which can cause allergic rhinitis. For example, if you know that you are very allergic to tree or grass pollen during their specific seasons, it would be best if you stayed indoors rather than outdoors.